Hi, Michael. Good morning. Thanks for joining us. My name is Georgie. I'm the founder of Angel Stack. We are a
Morning,
platform
Joshi.
that's trying, yeah, hi. We are a platform that's trying to push some visibility for early stage founders like yourself. So what we would do is we will try and have like a back and forth casual conversation, try and understand more about you and your business so that we can publish an article about you. Could you tell us a little bit about yourself?
Yeah, sure. I'm Michael Nazareth. I'm the founder of HealthMitra and a health tech entrepreneur for the last 10 odd years. I have experience in building customer first solutions across healthcare and other services. Over the years, I've seen firsthand how families in India struggle with out of pocket expenses, especially for routine needs like doctor visits, diagnostics, medicines, maternity, and elder care. I come from a background where trust and service delivery and the distribution networks have been at the core of my work. That's basically what I am all about.
Perfect. So your business, Health Mitra, are you the only founder or do you have a co-founder in this venture?
We have the chief elephant, which is Mr. Patrick D. Callahan. He's out of the US. So he's the co founder as well as the company mentor.
Brilliant. And it's the both of you that came up with the idea and that you've been building it for how long now?
We've been building it for a year and a half. The logic behind this was how to solve the problem of out of expense payments that go for medical healthcare at this point of time. So we built India's first OPD, first healthcare and financial ecosystem that actually helps you reduce costs in terms of your doctor consult, diagnostics, and pharmacy. It improves your access and basically brings dignity to everybody who's not been able to afford. Like we offer 50% discount on doctor's consult in India. So it can be any doctor anywhere in India. Just has to be an MBBS and above as a doctor. And we offer 50% to all our paid customers. So that means today, if somebody was not able to go to ₹1,000 MS as who's a doctor, we would have paid 50% out of it, and the customer would have got ₹500 back. So it basically helps. We give 30% off on medicines, where you actually get a lot of medicines only for 10-15%, or the top line online players are only giving like 15, 17, 18% maximum. We there to help people. Our impact basically the impact is we're almost 70 billion people in India who are having some kind of a medical issue or the other. And whatever we build are all scalable models, and it's just not refined to metros. So it's in tier 2, tier 3, tier 4 cities as well.
Perfect. So you spoke about how your platform has a provision where every single person in India could visit any doctor around the country and get a discount on the consultation or OPD or diagnostics, right? So have you approached all of these doctors? How many doctors do you have on your onboarded so far?
We service around 19,000 pin codes through our business partners. And wherever we are not able to tap onto as a consumer, the consumer can upload the bill and get a reimbursement done on his doctor consultations.
Perfect. So if I were a paying customer on Health Mitra, you were telling me that if I were to visit a doctor, like let's say three times this month, and if I spend 3,000 rupees, as long as I upload the document, you will reimburse 1,000.
Right. We would.
Brilliant. And may I ask how this works? Like, have you already tied up with all of these hospitals and doctors, or is it something funded personally by you or the government, like with some support to enable and help these individuals?
Okay, so this is basically funded by the insurance elephant and Health Mitra itself. So
Okay.
the actuary on the product has already been taken care of.
So when you talk about the insurance elephant, could you give it to me in a very simple sense so that I can understand better?
So my co-founder, Mr. Patrick, owns the insurance elephant in the US. The basic motto is to bring healthcare to every individual in the world. as per him. So that those are one of the key parameters that they believe in. They make products and distribute in different countries. So they help. So they've already helped in Nigeria. They do something with PayU for insurance on vehicles. In India, they do this with HealthMitra, which is us, and so on. They're doing multiple other projects as well.
Brilliant. Okay. So just to reiterate, now if I were to go to Aster in Kochi, and if I were to pay those that 3,000 rupees in consultation charges in a month, and if I were a paying customer on Health Mitra at the starting of the month, I would be able to reimburse this, or at the end of the month, if I get a premium account, and then if I submit those bills for the last 1 month, would I still be able to get the reimbursement?
Okay, so what this is what happens. So we really don't know when a consumer is going to get sick or is going to visit a doctor. What the consumer does is, say, suppose he walks in into Aster, as you claim, he simply goes and today he goes, suppose he visits Aster and takes the doctor prescription and the bill, uploads it into our CRM. Once he does that, within 3 working days, the working 3 working days, what would happen is we would then go ahead and verify the bill and clear the amount, and that would go into the customer's wallet where he is able to withdraw it whenever he feels like. However, he has a 30-day window to use the doctor consult and get it reimbursed. And this can be done anywhere in the country. So from Meghalaya to Jammu Kashmir to even Gujarat or Tamil Nadu or Kerala, wherever he feels like, he'll be able to get it.
Perfect. And may I ask, how did you both come up with this idea and how did they implement? How long did it take you?
See, it basically comes from the logic where healthcare becomes unaffordable. We can't get into the details of telling you what the backend story is. However, yes, the basic idea was how to ensure where, and I'm being very honest and upfront. The logic is the business model is pre-existing disease consumers that we target, and a lot of these customers who buys the product is only those customers who have a very regular visits to the doctors. We tie in the IPD to it, where we get a referral and then we move forward. IPD is basically when people get admitted, right?
Yeah. Okay. Got it. So your revenue metrics more than the subscription model would be from the conversion after the OPD is done. Fair enough. And can I please ask you how many paying customers do you have in India so far?
So we've in the last year, as a startup, we've added around 3,500 paid customers.
Brilliant. And can you tell me how does the marketing work for this? How do you reach out to your customers? Is it on a referral basis or do you actually actively spend money on digital marketing?
Yes, we spend money on digital marketing. Also, we've got almost 1,700 of sale people, which are insurance agents that work with us. We've also got a lot of hospitals who's who come forward and tell us these are the consumers that need help, because we also do 0% interest on medical loans. So if somebody is a Health Mitra customer, what we do is we go ahead and give them a 0% medical loan through our NBFC partners.
So, could you please list down all the services that Health Mitra offers? Because I understand there's consultation discounts, there's 0% interest loans. Are there any more that I should know about?
Okay, so it's 0% interest on medical loans. So it is a very big help for consumers. 50% off on any doctor's consultation in India. We do only allopathic. We're not into Ayush and all, or Ayurvedic. But let me put it in plain language. 30 to 50% off on diagnostic tests through almost 19,000 pin codes that we are servicing today. And we offer our consumers 30% on medicines that they order from us directly. We do a lot of health checks every year for these customers because we are a preventive healthcare company. We do their dental checks as well as their eye checks as well. And this is all given free of charge to the consumer as an add-on benefit. Also, we work with a company which helps them get quality elder care facilities, or let me talk to you as geriatric care. If you heard what geriatric care is, so we help people get nurses for themselves at subsidized rates.
Perfect. And you offer these services pan India.
We offer this service to pan India.
Perfect. So we were talking about dental, right? So what I understood is one of the biggest problems with us Indians, especially, is the fact that we do not get regular health checkups, especially when it comes to dental. Uh, so is there some sort of something that you are doing which could potentially help push your consumers to get regular health checkups? And is there some sort of something that could benefit people like myself who probably does it like once a year or once in 2 years?
See, we give free consultations on our network to all our customers. That is one. And we give them a free dental cleaning and scaling as a package. So once they go to a dentist and they're using this free of charge, they come to know exactly what is there or what is the problem that they are going to have in the next couple of months. And from there, they can take cues and get their issues rectified.
Got it. So when you say free, is this part of the paid plan that you have as a subscription
Yes,
model?
it is part of the
Got it.
plan.
Okay. Now I want to go to the subscription again. So you told me that it's your model works as a preventive model, right?
Correct.
Now, let's say I have only paid subscription for this 1 month. Am I still eligible for the consultation discounts and all of these benefits, or do I have to be like part of it for the last 3 months or 5 months or 6 months in the subscription model for me to be eligible for all of these
Okay,
services?
so we pay this as a yearly subscription, and customers can EMI it via their credit cards or via loans that we give them. And once they're tied in for a year, it is pretty big. They can use it as and when as they require. Also, we give them this notice that the product is anytime, anywhere used. So they just sign up and they start using it immediately. So it's like you buy the product today, and within the next 10 minutes you want to go to the doctor and get yourself checked for high fever, please go. We don't have a problem. Just download your e-card, put in your details on the network and move forward. Send us the bill within 3 working days. We will clear it, send it to your wallet, and you can withdraw it as cash out of your account. You want medicines within the next 10 minutes, you order your medicines what your doctor has prescribed. Somebody within the network will reach out to you. Basically, the pharmacists would reach out to you. Our own HealthMitra pharmacists or a network partner pharmacist, they reach out to you, confirm the meds, and get them delivered to you within the next 4 to 48 hours, depending on the city that you are in.
Brilliant. Now, my next question in terms of age, right? So I understand that doctor consultation visits may not be as frequent for me, or maybe a lot more frequent for somebody else, like who's older to me than for myself. So let's say I was a 50-year-old or a 60-year-old. Now, automatically, I probably have to do like 3 or 4 or 5 consultations in a month, or maybe 10 in a year. So all of these are covered despite the age gap and
Limit. There is no limit on any number of consultations that you wish to take. It can be a day old baby to 100-year-old citizen of India. The product is built in such a way that it is unlimited use to the consumer. We've got the stories where, people have paid us 7,000 rupees and they've taken 40, 45, 50,000 rupees as benefits. We've got a lot of stories on our network.
So now I think this is quite brilliant because what I've understood is that every single person who visits the hospital, unless they get, like they're admitted, they cannot avail the insurance. Now, Health Mitra is solving a problem where even without insurance, if I were to spend, let's say, uh, 500 rupees on the consultation and another 1,700 or 800 rupees on an X-ray, like the entirety of that bill is discounted and reimbursed to me. So the problem of insurance, which the insurance by default is not able to solve, Health Mitra is solving it for all age groups without any discrimination.
Correct. And so it's all age groups covered. Also, we have pre-existing disease consumers on our panel who basically buy a product like this. Somebody who's got cancer or maybe dialysis or cardiovascular or diabetes, they're basically left out or by the insurance or they have a huge waiting period. But for us, the consumer immediately starts using the service.
Okay. So even the dialysis, this the cost on dialysis is discounted and then reimbursed back to the customer.
The cost of dialysis is not, so that goes under the treatment section. However, the
Got
doctor
it.
visits, the diagnostics, and the pharmacy is at least covered for them. So we're basically reducing their healthcare costs. Obviously, we can't 100% cover everything. But yes, somebody who's on dialysis visits the hospital on a very regular basis for dialysis, maybe 4 to 8 times a month. However, at least one or twice a month, he or she goes to the doctor to check on their health. Now, that is never covered. We cover it. To get their phosphorus or for that matter, the LFTs, KFT diagnostic tests, we cover it at a discounted price. And medicines, obviously, again, 30%, the best that we can offer. And in India, we're the only ones who do 30% as a discount.
May I ask, where are you based out of in India?
We're based out of Delhi.
How big is your team currently?
Our team is 14 people strong.
Can you tell me if I were to, let's say, I were to give you an unlimited amount of money and say that you could hire one person to finish off something very important for you? That's something that's been bothering you for a while. Like, you know that this resource could literally help me scale up my business. What would that investment go into?
On a very practical note, currently we look at hiring a tech guy who basically has AI who helps build our product on an AI basis where our bills get approved much faster. Because in our organization, we get a lot of bills, and our consumers sometimes resort to fraud because these are basic bills that come to us, and you know how things are happening. So build our tech around AI where our bills can get verified much faster. See, 3 to 4 days is basically takes for our bills to get verified. The insurance takes anything between 15 and 45 days to return a bill when it goes for reimbursement. So we're trying to even reduce that timeline.
Got it. So talking about frauds, right? So I can understand that as an Indian consumer, like we are all prone to the idea of jugaad. Now, if I were to, let's say, pay 500 rupees for 12 months, that's 6,000 rupees out of my pocket for consultation, automatically we have this whole mindset that I need to recover that money.
Correct.
Now, at the end of the 12 months, if I have not had doctor visits, it's possible that I might just make up these documents and like submit it so that I can try and get these reimbursements. So currently you have a very manual process to get this done. And can you tell me in the last 1.5 years that you've been around, how many times have you got such cases?
We've looked at around 1% of our current value of customer in our value chain. Around 1% of our customers are sending in fraud bills. However, as a consumer, they also need to understand this. It does not help in the long run. You can get away with one time, two time, but when it becomes a regular process, it helps. And with AI, if we feed in the details, we'll be getting this done faster. Because see, somebody visits these doctors various parts of the country. So from being a smallest hospital or a clinic to being the largest hospital in India. So what we do is there's somebody who does the checks and balances into play, and we have a fraud detection unit. There are the pretty strong people, but there is a percentage where things flow through, and that is the reason why we're wanting to count into AI and get this sorted out immediately.
Got it. So how do you tackle these problems? So you said these problems. So the thing is, you said that 1% of, let's out of 100 customers, there's one person who's always submitting, maybe not always, but potentially submitting these false documents, right? So how do you tackle this problem? Do you like completely uh, shun them away from your system, or just say that, listen, you reach out to your customer and say, listen, we found that this is fraudulent. We are not going to be processing this document. So going forward, please take note.
No. See, what is basically happens is we already tell the customer, sir, we get these bills checked on day one when they sign up. They know exactly. So the terms does mention it that if you provide us false documents, we would then go ahead and ban you from the system because the benefits that we offer are pretty prudent and pretty great. We don't want the system to shun away or get faltered because of people like that. So we basically push it in such a fashion. We will inform the customer why the fraud has happened, how the fraud has happened, where we've got it checked, because we have direct connectivity with the hospitals, with the doctors, everywhere. And if any mishap has happened, we inform and we block the consumer in our systems. That way, there are a lot of checks and balances into place. But yes, the customer also needs to understand where the problem lies eventually. As I had mentioned earlier, we've got a lot of customers that have, but just by paying 7, 8,000 rupees, whatever they signed up for, they've taken 40, 50, 45, 50,000 rupees as benefits across the year. Fantastic deal that they get out of the OPD assurance as a program. But they still need to look at things.
Can you tell me some very funny incident that you personally had to deal with? I'm sure as a founder with like good years of experience, you probably have come across one of those incidents and you're like, okay, maybe I should share this with a larger audience at some point.
See, in the B2B segment, we sell a maternity insurance. Care insurance is part of our who we've tied up with, and we give it to our customers, where we give a 9 month wait period for any consumer. So it's basically like when you buy the product, there is a 9 month waiting period before which the insurance does not come into play. So the insurance gives 50%, 50,000 rupees as delivery charges to the hospital, but it's exactly 9 months. So we had come to a point where we had to stop it, primarily because what people were doing was they were getting pregnant, and then when they come to know that it is that they are pregnant, then they go and buy. We experience this especially in North India. Once they go to the doctor, when the lady goes to the doctor and knows that pregnancy is underway, then they buy the product and they don't let us know that either. And eventually, when the insurance and us, when the bill comes, the OPD, there's never a problem. So you can use it from day one. But when the insurance product, because it's bundled, right? It comes up, then they come to know about it, and then they say we never knew about it, and it became too much of an hassle. We had to shun out almost 1,000 consumers out of our network only because it it's plain language. Wait for 9 months, and only then delivery costs are covered. But we buy it just looking at a 9 month cover. It's okay. It happens.
Yeah. Now, can you tell me what is in future for Health Mitra? Because you've been around for quite a while. What is going to happen? Like, as in, there's a lot of influx of AI, and everyone's talking about AI. Yourself spoke about how you wanted a resource who could deploy an AI system in your organization. Now, can you tell me in the next 1 year, what is Health Mitra going to be like?
Okay, so Health Mitra obviously walking forward with the same program. However, what we are adding on to it is national. We've tied up with NHA for the Ayushman Bharat program, where we are building a HIS. We will equip ourselves and the organization to interact directly with the hospital as well via the HIS that we're offering them. So that would also include all the ASHA workers in the country. Plus, we already have understood the solution for cost reduction on pharmacy or other medicines for consumers. We already have 3 pharmacies into play in India currently, but all of them are out of Delhi that we currently run. Those are physical pharmacies. So we want to do this online now and offer a better rate to all consumers, reach out to 20, 21% maybe, and become a national player online. Because eventually there is a need for quality drugs at a lower cost.
That's mostly all of what I wanted to cover about you. But before we wrap it up, I just wanted to say congratulations on the
Thank you.
incubation with IIT D, right? Can you could you please tell me a little bit more about that journey and how that came to be?
It has been a very long journey. We've gone through a lot. We've proved the metal with them. We've shown how the business works, and eventually they signed us in. We're looking at funding, and one of the reasons why they tied up with us was because of that.
I genuinely do hope you guys get the funding that you require, and then this turns out to be a national brand that you aspire it to be.
Thank you.
Thank you so much for your time, Michael. I'm looking forward to interacting with you more in the future.